What is Hirayama disease? If you have done a flexion extension MRI of your spine for weakness in your hand or in the wrist area, and your neurologist is suggesting that you have Hirayama disease, what is it exactly? So let's talk about Hirayama disease today. This normally happens in male adolescents, basically between the ages of 15 to 25 years, and it is more common in male patients as compared to female patients. The reason is the discrepancy between the growth rate of vertebral column and the spinal cord. The outer layer of the spinal cord, which is known as the dura. Normally that layer of the spinal cord gets stressed whenever there is a movement in the spine, especially when there is a discrepancy in the growth. So what happens, as the vertebral column elongates during the growth spurt, so does the spinal cord. But the outer covering of the spinal cord dura sometimes may not get stretched enough to accommodate the growing vertebral column. In that situation, whenever the patient moves the neck up and down, some amount of friction is there between the dura and the vertebral column. Because of this, the blood flow or the small blood vessels in that area, sometimes they get affected, and there are ischemic changes in the spinal cord as well. So because of this, the patient might develop weakness in hand muscles, wrist muscles or forearm muscles, and it can be on one side or on both the sides. It can be symmetrical or asymmetrical, or it can be progressive, or it can progress to a certain extent and then restrict itself. So normally for such situations, the neurologist first of all suggests that you should restrict your spine movement. So he might suggest you a collar. That collar is to be worn for a variable period of time, but normally the aim of collar is to restrict the movement. Secondly, he might give you some nerve medicines. Thirdly, he might give you some short course of steroid if the problem is profound. However, if nothing works, then surgery might be indicated in few cases where we do a surgical stabilization of the spine and we create more space for the spinal cord. Now what happens? This surgery can be done through the posterior or the back approach, or it can be done through the front approach or the anterior approach. Normally posterior surgery is required, where we stabilize the posterior part of the spinal cord. We make enough space for the spinal cord, we fix the bones to immobilize that segment. This normally gives good result. So if you are suffering from Hirayama disease, don't worry, visit your spine surgeon or neurologist and he will advise you what next is to be done. Thank you.